New South Wales is now witnessing what other parts of the world have, with this Omicron COVID variant spreading faster than other strains, case numbers doubling every 2 to 3 days. Today, the state has recorded 1,742 new cases and no more deaths, and that graph pretty dramatically illustrates what is happening. It's important to emphasise, while these numbers are concerning, authorities say they're confident that the health system has been prepared for whatever this next wave throws at us. And that will be a key focus over the coming weeks and months. We're in the very early stages of this next wave right now. So 192 people are in hospital in New South Wales with COVID. As you can see, that's a slight increase on yesterday, but the number of people in intensive care remains in the 20s. The Health Minister said yesterday modelling had indicated that New South Wales could get up to 25,000 cases a day by the end of next month. One epidemiologist we've spoken to this morning has said it could well happen before then. The Chief Health Officer, Dr Kerry Chant, said yesterday it's clear this Omicron variant is highly transmissible, but it's not yet clear how many people will become severely ill from this. While the Health Minister said there were early indications it would not be as severe in terms of people getting sick. So there's a bit of conflicting information there. There's still a lot to be learned about this variant while the case numbers start to grow exponentially. In terms of vaccinations in New South Wales, more than 93% of residents over 16 are double vaccinated, and just under 95% have had one dose. And reporter Bindi Bryce has more now from Newcastle, north of Sydney.
So roughly 1,700 figures is an increase from yesterday's number, and it shows that more people are catching the virus and the spread of the virus is not calming down at the moment. We do expect a decent number of those cases to be here in the Hunter New England Health District. Yesterday, about a quarter of New South Wales's cases were in this region. And, as of yesterday, there were about 800 active cases of COVID-19 in the Hunter New England Health District. So people in Newcastle are catching COVID at quite a rapid rate. We'll wait to see later today what the exact breakdown of those numbers is, but it is expected that a decent chunk of today's cases will be here in the Newcastle area after that superspreader event last week at the Argyle.
And Bindi, what have health officials had to say about Omicron in the region? And take us through what has happened with numbers from that Argyle superspreader event that night. I think it was last Wednesday night when there was a party there.
So, like you mentioned earlier, there seems to be signs that the case numbers are doubling each day. A couple of days ago, we recorded about 200 cases of COVID-19 in the Hunter New England region. And then yesterday, we recorded about 400 cases. So the case numbers do seem to be rising. And New South Wales health officials have said that the majority of cases here in Newcastle are likely to be the Omicron variant. So we are starting to see signs of just how easily this virus can spread. And, it's been a week now since that massive party was held at the Argyle, and we know that at least a third of the roughly 700 people who went to that party have caught COVID. So quite a high percentage of people who are catching COVID from going to these parties or nightclub events.
And Bindi, another pub is shut for deep cleaning there in Newcastle.
Yeah, so the Cambridge Hotel just next to me, there has been a COVID alert issued for this place. Anyone who went here last Friday from about 6:30 p.m. to about 2:30 on Saturday morning is a close contact, and they have to get tested and spend some time in isolation, especially because it's believed that some people who came here while infectious during those times were carrying the Omicron variant. So given at the moment that it is Christmas, this did happen on a Friday night, it's likely that probably a few hundred more people are going to have to go and get tested and spend some time in isolation. I think that's probably the worst thing about this outbreak at the moment, is that it's just affecting so many people's Christmases, and there is this really heightened risk of COVID in the community at the moment, and we are dealing with this new strain of the virus.
Now taking a look at the COVID figures through for Victoria this morning. So 1,622 new cases, and as you can see there from that graph, that is starting to break out from what the trend has been over the last several weeks. Up until a couple of days ago, it had generally been between 1,000 and 1,300 to 1,400 cases a day. It's starting to pick up now, and 9 people have died with COVID in Victoria in the last 24 hours. So 9 more groups of family and friends dealing with the loss of loved ones as part of this COVID pandemic. Excuse me, in Victoria, 384 people in hospital. So that hospitalisations are picking up in Victoria as well as the number in intensive care. That's now 87. Nearly 92% of people 16 and over are fully vaccinated. 94% of the 16 plus population in Victoria has received at least 1 dose of vaccine. And restrictions have eased a little in Victoria, but concerns remain about a potential Omicron super spreader event in Melbourne's inner north. Reporter Jetta Costa has more from Melbourne.
Victorians are waking up to slightly more relaxed restrictions this morning, meaning that people will no longer need to show their proof of vaccination when entering non-essential retail venues, auctions and real estate auctions and inspections, places of worship and weddings and funerals. That's if it's not at a hospitality venue. But people who do want to enter hair and beauty salons, they still need to show their proof of vaccination. Also, under these new changes, people under the age of 18 don't need to show that little green tick before entering any door of any venue across the state. But for hospitality venues like pubs, cafes and bars, it's still only open to the fully vaccinated, and their workers must wear masks.
And this comes amid a potential Omicron super spreader event.
Yeah, that's right, Joe. So around 700 people have been forced into isolation as they wait for their COVID test results. That's after a confirmed Omicron case attended 2 venues in Melbourne's inner north, including this one behind me, which is the Circuit Bar in Fitzroy. The other venue is the Peel Hotel, which is a couple of 100 metres down the road in Collingwood. Now, also under the new pandemic laws that came into play last night, mandatory mask wearing will stay in place for all indoor retail settings over the Christmas period. So meanwhile, Victoria's Chief Health Officer has warned that around 400,000 Victorians are overdue for their booster shot. So it's hoped that these new restrictions will ease further, and that just depends on vaccination uptake at this point.
There are calls for clarity in Queensland after quarantine confusion for passengers on 2 flights. Reporter Rachel McGee joins us now from Brisbane. Rachel, g'day. So how's the tourism industry responded to yesterday's change in quarantine rules?
Yes, of course, all passengers on 2 flights, one from Newcastle to Brisbane, the other from Brisbane to Townsville, were initially deemed all close contacts of a man who tested positive on those flights. Now, with those being close contacts, they are initially going to have to go into 14 days home quarantine. However, Queensland Health changed its ruling on that yesterday morning, saying that only the 2 rows in front and behind the man would have to go into quarantine. The tourism industry here in Queensland has spoken on this and said that while Queensland Health did change its ruling on whether people would have to go into quarantine, the damage has already been done, with a lot of people interstate seeing what happened and now reconsidering travel plans here into Queensland. And that's what they're really worried about, that travel will be deterred and businesses here in Queensland that are already struggling will hurt even more if people are worried about coming into the state. So they've said that Queensland Health has overreacted on this one, and even though they did change, they're worried that people will still reconsider their travel plans here.
And new rules come into effect for the unvaccinated tomorrow.
Yes, that's right. Today is essentially the last day of full freedoms for people who are unvaccinated. New rules come into effect tomorrow that will see people only allowed to enter hospitality, sporting and entertainment venues if they are fully vaccinated. They'll have to show proof of vaccination through the Queensland check-in app when they enter somewhere. So, yeah, the last day of full freedoms for those who are unvaccinated. And if they do get caught trying to enter one of those venues, they can face fines of up to $1,300 for individuals and $6,000 for businesses if they're caught flouting those new rules.
OK, Rachel McGee reporting there in Brisbane. More than 20 aged care homes in Adelaide have been caught up in a COVID scare after 2 infected staff worked across different facilities. Several sites have been locked down, and South Australian Premier Stephen Marshall has signalled rapid antigen tests could be used in the industry in future. Hundreds of people waited for testing last night. The state recorded 25 new COVID cases yesterday, its largest daily total since April last year. The UK has recorded its highest number of daily coronavirus cases. More than 78,000 new cases were confirmed in the latest reporting period. The Prime Minister Boris Johnson has defended his strategy to slow the spread of the disease.
I think this is the right approach. It's a double strategy. It's a left and a right for Omicron. We're going with Plan B, as we said we would, in the event of the numbers starting to rise and in the event of a new variant appearing. And that's the right thing to do. And everybody, you'll have heard me repeat earlier on what we need people to do: to use ventilation, to wear masks inside, continue to wash your hands, exercise caution. Today, the highest ever daily number reported. And the doubling rate of Omicron in some regions is now down to less than 2 days. And I'm afraid we're also seeing the inevitable increase in hospitalisations.